Hi, everybody. Welcome to our newest webcast. I am Ed Shin. I'm the CEO, co-founder of Quality Reviews. And for those of you who don't know us, we help hospitals and health systems collect real-time feedback from patients for the purposes of improving the experience, service recovery, and operational improvements. This webcast, I'm so excited to introduce Shareef Mahdavi. And Shareef is the author of a brand new book called Beyond Bedside Manner, Insights on Perfecting the Patient Experience. So without further ado, I wanted to welcome you, Shareef, to the webcast. And first of all, I just want to know, and for the viewers here, tell us a little bit about yourself, your background, how you got into this world of patient experience, and then we can talk a little bit about your book.
Yeah. Thank you. Thank you for having me on the program. Glad to be here. I could tell you a lot about my personal life, married and three kids and all that. But I think today we're going to focus on what we're all trying to solve, which is how do we improve the patient experience? And not only, your organization, but I think there's a growing awareness around from doctors and practices around the country of the need to do this. My background, I've been working with physicians now for well over 30 years. A lot of it has been in the elective space. So when you think about those procedures and technologies that patients pay directly for the service, whether that would be LASIK or an upgrade to traditional cataract surgery, or in the aesthetic space, all the facial injectables, plastic surgery, cosmetic dentistry, and increasingly in other areas where technologies are being developed and the innovators understand that Medicare and insurance probably isn't going to pay for this, especially if it's a lifestyle enhancing procedure versus a life-saving procedure. So the business model involves the patient paying for services directly to the doctor, and then the doctor probably taking part of that revenue in the form of the consumable or disposable they need to purchase and forwarding that on to the manufacturer, in addition to the outlay if there was a piece of capital equipment at the beginning. So we think of that as the self-pay space, the elective space. I've lived there now for a little over 20 years.
Got it. Great. Awesome. So tell us, this is a great book. I've downloaded it onto my Kindle and I've started reading it. Why did you write the book?
Well, it's really a passion of mine. I think ever since I was a little kid, I was always interested in customers and customer service. And as I went through my teenage years, the kinds of jobs I had, I was a busboy, I was a waiter, I worked at the deli counter. So I had a lot of exposure face-to-face with customers. And I got to learn pretty quickly what was good service, what was poor service, how you could make customers happy. I get asked all the time by people my age, what do you recommend our kids do as a summer job or to get kind of job experience? What internship should they get? And I say, no internship required. If they could be a waiter or a waitress for a summer or a semester, it's phenomenal, because you think about all the elements of that. You've got to learn time management, juggling priorities, interfacing with customers, dealing with complaints, and you get immediate feedback in the form of a tip. Right. So those have a lot of elements that are true in every customer interaction. And this book simply takes my life's work, which has been always about helping physicians do better in their practices, whether it was incorporating technology or building a better patient experience with their team, or even now in financial matters. We have a lot of merger and acquisition activity as private equity has come in, particularly in ophthalmology, and is making a play to own ophthalmic practices. So in these areas, I focused on helping doctors do better. And the book was really a summary of my career's experience on this one issue of helping doctors understand the importance of patient experience, why it's so important, and how they can think about it for improving it in their practices.
Got it. Excellent. So you touched upon the audience in terms of the self-pay, perhaps concierge, aesthetics, dermatology, plastic surgery, dentistry, LASIK. Are there other members of the medical community who you think should read the book? So I'm thinking, the cardiologist, maybe the infectious disease doctor now in this time of pandemics. How would you position this book to that audience?
Yes, it's a great question. And I think this is appropriate for any physician. And it's not just me. I had a large number of doctors who I've known over the years do an advanced read on it. And the feedback that kept coming back was every doctor should read this. Every medical student should read this, because it doesn't just apply to the, let's call it, elective procedure. It applies to every interaction between a doctor and a patient. And if we were to rewind the clock a little more than a generation, Ed, you might be too young to remember Marcus Welby, MD.
I remember.
Okay, but
Yeah.
think about what that meant. And really, I think Marcus Welby is the iconic representation of that friendly, kind doctor with great bedside manner, always smiling, always, just there to listen and give good counsel to the patient. Okay, well, those days are gone, right? They're gone because of the advent of everything from managed care to new technology, things that kind of, in a way, served maybe inadvertently to separate and create distance between the doctor and the patient, right? Now we have nurses and technicians, we have billing staff, we have lots of technology, we have many subspecialties. So something's gotten lost along the way. And I do not